Thank you, everyone, for joining us. Let's jump right in. To date, 829,966 tests have been run in the state of Illinois, with 25,993 being reported in the last 24 hours. As of midnight, 3,649 individuals were hospitalized with COVID-19, and of those, 1,009 patients were in the ICU and 576 patients were on ventilators. Since yesterday, 1,527 new confirmed cases of COVID-19 were added to our Illinois total, which brings our total confirmed cases to 115,833. Yesterday, many of you may have noticed that we passed a grim milestone, if you will, of over 5,000 lives lost. We are at a total of 5,186. I would be remiss if I didn't offer my condolences and my sympathies to the families of all those who have lost loved ones associated with this virus. We are all truly sorry for your loss. Fortunately, an additional 104 individuals were reported to have lost their lives in the last 24 hours. So among those that have passed associated with COVID, almost 44% were those in long-term care facilities. And as we've known from the beginning, nursing homes and other congregate settings have always been at increased risk for outbreaks. On March 14th, we reported the first COVID-19 case in a long-term care facility in Illinois. IDPH was on site immediately to provide guidance on infection control practices, to ensure proper donning and doffing of PPE, and to assist with mass testing. This plan was put into action with the full support of Governor Pritzker, and we can't thank him enough for his encouragement and always wanting us to be proactive in all of our responses. I remember going to that first facility in DuPage County to support the team that consisted of the nursing home staff, as well as local health department staff, IDPH staff, and our infectious disease consultants. Of course, it's helpful to be there to see firsthand what's happening, and it was a great example of collaboration. We do understand that the burden of disease in facilities is high in these high-risk congregate care settings, but we're ensuring that swift action is being taken, and we know that facilities must immediately notify public health officials of any confirmed COVID-19 case, whether it's a staff or a resident. And this notification should also confirm that that specific facility is notifying all staff members, all residents, families, and their representatives by the end of that day. Our dedication to this population has never wavered. We continue to support long-term care facilities. We continue to promote the health and safety of everyone therein, the residents and the staff alike. As a state, we are definitely headed in the right direction. We have successfully met the metrics to advance into phase 3, but we must still proceed with caution. The risk of contracting the virus remains, so I implore that we continue to practice the use of face coverings, washing our hands, and be physically distant as much as possible, with a minimum of 6 feet. Let's continue to do the hard work that is necessary to get us to the other side of this pandemic.